Hey everyone, it's Ryan Liberty, and in this video I'm going to talk about why therapy is not working. What am I here for? Alright everybody, so what am I here for? I'm here to help humanize mental health and show how mental health affects us in a well-rounded way, and it kind of shows up in all of our different lives. And in this video we're talking about why therapy does not work. So I came up with a bunch of different reasons before I sat down to record, and you'll see me looking at them down here below. But I kind of came up with 3 different areas that I think kind of get in the way that make therapy not so effective. So the first one is your therapist, and one of the things could be that you're just not clicking with your therapist. You know, it does take a couple of sessions, maybe 5, 8, depending on what's going on, to get to know your therapist and find out if there's like a good click between the two of you, if you have that ability to kind of be open and have discussion with them without being fearful. And if that isn't there, if you don't have that kind of rapport with them, then it could definitely get in the way of you getting the treatment that you need. So it's important to click with your therapist, to have that feeling of safety and security, and to generally like them and be able to talk with them. So that would be on your therapist to create that environment. You're not going to click with every therapist, so it's not completely their fault if that happens, but it's important for them to create an environment where you do feel safe and you feel like you can communicate. Also, as far as your therapist goes, if they don't have experience with the particular issue that you're grappling with, that could get in the way. So for people who've gone through trauma, for example, they have to be treated a specific way that's different from the way that somebody who's coming in for other problems may be. And if the therapist doesn't have experience treating people who've gone through trauma, they'll just keep trying to treat them the way they would treat somebody else who comes in, and doing it that way is not going to help that person because the treatment's not effective. And that kind of rolls into my next one, which is that the therapy that's being done on you doesn't match. So when you go to therapy, there are standard therapies that are kind of used pretty often, things like ACT, CBT, DBT, psychoanalysis, these kinds of things. They're just standardized, and it's kind of the typical approach to come at specific situations, but they work broadly and they are used for that reason. But if your issue is something that's a little bit more specific, that needs to be tailored a little bit more to your situation, and you need a specific kind of therapy, and they're still approaching from that broad therapy and they never really modify it to fit you, then they may be applying the wrong principles, applying the wrong skills to you, and you're not getting the correct therapy that you need. So that's something else to also be watchful for. And finally, if your therapist is not really keeping progress or keeping track and maybe has goals for you, they are supposed to have a file on you, but if they're not really like mindful every time you come in of like, okay, where are we now? Where are we headed? How are we going to get you to the place you need to be? Then they may just kind of go through session to session to session, never really getting anywhere and never really being mindful of the fact that you aren't getting anywhere because they're not paying attention to that. So that's important for the therapist to be doing. So that was kind of my first area, was looking at some issues with the therapist. The second area you may want to look into is medication. So the first thing would be if you're not on medication, where maybe you need to be on medication. So medication is not a bad thing. There's nothing wrong with being on medication. Some treatments sometimes require medication. For example, if you have schizophrenia, or maybe you have an anxiety or depressive disorder, sometimes you can't go through the normal therapies that would be needed to treat those things without first using medication to get you to like a nice healthy baseline where in the case of anxiety, for example, maybe it's so overwhelming that you can't think, you just can't handle the situation, you can't handle the stress of being in the room with the therapist enough to reason through anything. So medication can kind of help that and can bring your anxiety level back down enough that you can sit there and talk and reason things through. So medication is very helpful when it's necessary, so don't be afraid to look at that as an option. It may be needed to help progress you forward in therapy. Also, it could be that you're on the wrong medication, and I know there's a trial and error period. You'll of course want to talk with your psychiatrist about that, but sometimes If you're on the wrong medication, it can wind up hurting you instead of helping you when it comes to therapy, because it's not doing its job and it may actually be making things worse. So you'll want to look into that. I know there's also transition periods where it takes time to get on medicine and get off of it. So you'll also want to be aware of that. But if you're on the wrong medication, that could get in the way. And also, if you are not taking your medication, that will also be a reason why therapy is not really working so well, because if the medication is there to help you and you're not taking it, then again, you may not get to that baseline that you need to be at to progress. So medication is the second area that I say to look into. And then finally, the third area would be you don't get off the hook here. And I have another video you may want to look into about why some people never seem to get better. But there are some things that you may be contributing to why you're not really getting better in therapy. So one of those things is that you don't believe that you can get better. That is critical for getting somewhere. I mean, the therapist can definitely still work with you even if you don't believe that you can get better, and they can work on that belief with you. But if you don't have this feeling that you're ever going to get better, you're not going to have that motivation to get better. You're not going to do the things that are asked of you. So it really is crucial that you do believe that you can get better. And again, a therapist can work with you if you're having a hard time believing that yourself. Also, if you're not going to therapy, it's going to be hard for the therapist to do their job. So I know some disorders may make it very hard to go to therapy. You may have a phobia, you may have social anxiety or like an agoraphobia. It makes it hard for you to go out and see somebody. But if you're not going, it's going to be really difficult for the therapist to be able to do their job. And again, that may be an instance where medication can come in and help you to be able to get into therapy. Another instance would be if you're not opening up in therapy and you're not giving those vulnerable parts, those truths inside of you that need to come out. Some things like trauma, if you don't go back and examine some of those really painful situations, then the therapist can only do so much for you. Trauma has to be faced. You have to approach trauma in order to resolve it. Now, that doesn't mean you have to do it all at once. And of course, a skilled therapist would never do that. But you do have to open up a little bit, and you have to give a little bit and be a little bit vulnerable in many cases when you're in therapy to progress. Also, if you're lying to the therapist, that's going to be a difficult one for the therapist to help you, because they're going to not have the truth. They're going to have things a little bit distorted. Now, a good therapist may be able to see through some of your lies and may be able to challenge you a little bit, but it's really your responsibility to not lie, to not cover things up. And maybe if it's hard, then you can kind of like slip it on a piece of paper. You know, I think I lied a little bit the last time I was with you, hand it to them and let them kind of figure it out from there. But if you're lying, then it's going to hinder your progress in therapy. Also, if you're not doing homework that your therapist gives you, if you're finding it difficult, that could also be a problem. It's being given to you for a reason. It's being given to you in order to help you get better. And if you're not participating and doing the homework, then the therapy may not be as effective. And maybe that would be an instance to switch therapies and try something different. But if you're not doing the homework, it's going to hinder your progress. And finally, it could be that you have a secondary gain when it comes to being or having the mental disorder or having the mental problems that you're having. And secondary gain is simply that you get a benefit out of being the way you are. So maybe you get a lot of attention because you have a mental disorder. Maybe people take care of you because you have a mental disorder and you don't want to lose that. So that can make it a little frightening, and you may kind of resist the therapist's help because of that. So that's something else to be mindful of. So that was the third one, you. So you've got your therapist, you've got medication, and you've got you. And those are three different reasons why therapy may not be working so well for you. So I'd love to hear from you. I know this is not a list of everything that may be going on. What do you find is true for your situation? What do you think is making it hard for therapy to work for you? Go ahead and leave that down below for the rest of the community, and we can try to help you out. And thank you for taking the time to go over this with me and share it with the rest of the community and help us all to humanize mental health. Do you give a about mental health? If you do, then I've got some free coloring pages I think you'll enjoy. Go ahead and click to get those. If you like this video, I have many more on YouTube. Subscribe to see the rest of them. And if you have any questions or comments, please leave those down below for the rest of the community and share with a friend. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay and you are loved. Thanks again for watching.